All right, hello everyone. We're going to do the cardiac portion of our head to toe assessment now, okay? Again, I am Professor Roselle, the Learning Resource Coordinator here at Samaritan, okay? Anytime you assess your patient, you're going to want to do those standard precautions. You're going to want to wash your hands, you're going to want to put your gloves on, okay? So I will do that right now. You are always going to want to introduce yourself to the patient. Hello, I'm Courtney. I'm going to be your nurse today.
Hi, Courtney.
Hi, do you mind telling me your name and date of birth?
Ruth A. Davila, 3/11/34.
Perfect. And Ruth, do you know where you are today?
Samaritan Hospital.
Perfect. Do you know what day it is today? What day of the week?
Tuesday.
Oh, perfect. And do you know, are you in any kind of pain right now, Ruth?
No pain.
Okay, perfect. And no chest pain?
No chest pain, no shortness of breath.
Perfect. Thank you so much.
You're welcome.
Ruth, do you have any kind of history of any kind of cardiac surgery?
No cardiac surgery.
No bypass, nothing like that?
No.
Okay. Do you know if you have a family history? Does anyone in your family, have they had cardiac surgery or any kind of bypass?
None that I'm aware of.
Okay. All right. Thank you so much for letting me know that.
You're welcome.
Alrighty, so you want to make sure you ask those important questions to the patient, okay? Especially if if Ruth says she was in pain, you want to make sure it is not, especially depending on why she came in, especially make sure that it's not chest pain, okay? Ruth, if it is okay, I am going to listen to your chest quickly. And when we listen to the chest of our patient, we want to make sure that we hit all of those cardiac landmarks, okay? A nice way that I like to remember the cardiac landmarks is all people eat turkey meat, okay? So really just that first landmark, okay, second intercostal space down, is the only landmark that is on the right side of your patient, okay? And do remember that if you are looking at the patient, it is their left and not your left, okay? With the bell of the stethoscope, we are listening to these landmarks, okay? While you're doing this, I'm walking through it fairly quick, but you do want to give adequate time to make sure that we are listening. There are no murmurs, okay, and that heart sounds regular, okay? Perfect. And you end right here, which is exactly the fifth intercostal space, mid-clavicular down, and that is where you can find your apical pulse too, okay? So I'm not going to wait here a full 60 seconds, but you know, that is what you do want to do when you are assessing your patient and their heart rate and rhythm, okay? All right, thank you so much, Ruth.
You're welcome.
All right, Ruth, if it's okay, I'm going to grab a couple pulses, both in your kind of arm area as well as your feet. Is that okay?
Yes.
Okay, so I will take your brachial pulse first, okay? And that is right in the inner portion kind of that elbow joint, okay? And you want to make sure that you feel it, okay? It goes from, you know, +1 to +3, okay? +2 kind of being the normal that we're going to feel, okay? And a good idea too sometimes is to do it bilaterally, okay? Because you can compare the two sides, all right? We did the brachial, and we'll say we did that bilaterally, and then we're going to check that radial pulse, okay? Similar to the brachial pulse, you are going to want to make sure, if you can, do it bilaterally so you can compare, okay, on the elasticity of both pulses. While I'm here with Ruth's arm, I am going to check for cogwheeling, okay, which is important in the neurological assessment. What it is, you're going to passively hold your patient's arm and kind of bend it up and down, okay, assessing for any kind of creaking, you know, joint cracking, okay. This you may see if someone is on any psychotic medications or like if they have Parkinson's or something similar to that, okay. Another portion of the neurological exam that I do want to do now, because we are with her arms, is you would have your patient hold their arms out and observe for any type of tremoring, okay, so kind of shaking. Same thing with their tongue. You could have them stick their tongue out and see if that shakes as well. All right, thank you, Ruth.
You're welcome.
While I'm doing that as well, I am assessing her skin, okay? making sure that the coloring is within defined limits, okay, that her hair distribution is normal, okay, that her skin kind of feels warm to touch but not too warm, okay, and you know, everything is, you know, as you would expect it to be, okay. So we're then going to assess her pulses, okay, in her legs, okay. You would be doing 2 sides, but for time, I'll just kind of do 1 side, okay. You're going to check her posterior tibialis pulse, which is towards the ankle, okay, in the medial aspect of your patient. It is a good idea to do those at the same time as well to compare, and then your pedal pulse too, okay. All right, and at this time too, I am assessing for hair distribution, coloring, okay. I'm making sure there's no areas of, you know, warmth, okay, or coolness, especially compared to kind of the center of her body if it's cool down there, okay. All right. So at that time too, you want to make sure that, of course, I'm so sorry. While you're down here too, you want to make sure that you're checking for edema. All you have to do with that really is kind of press into your patient's skin, okay? Make sure that it doesn't pit, meaning that there's kind of an impression that stays on that patient, okay? So that's another very important thing to assess bilaterally on both legs of your patient, okay? That's kind of it with the legs. All right. So thank you so much for watching, and that was the conclusion of the cardiac assessment.